Hi, I'm Dr. Stephen Kelly, your go-to guy for all things bariatric surgery or obesity. If you're struggling with obesity and researching options, you may have heard about the endoscopic sleeve gastroplasty, otherwise known as the ESG. But how does it really compare against the proven and safe operation of laparoscopic sleeve gastrectomy? The endoscopic sleeve gastroplasty is done endoscopically. A flexible tube is put through the mouth and no incisions are on the outside of the body. The doctor sutures and folds the stomach to shrink the stomach size to make it 70% smaller. The laparoscopic sleeve gastrectomy, on the other hand, is keyhole surgery. Some small incisions are made in the abdomen and tiny cameras and tools are used to remove about 80% of the stomach. The stomach is shrunk from the size of a football to a banana-shaped 50 ml long thin tube. A recent large review by the World Society of Obesity, called IFSO, confirmed that the ESG resulted in an average body weight loss of 15%, which was stable over 5 years. It was mainly used for people with lower BMIs, with an average BMI of 37. A laparoscopic sleeve gastrectomy results in double the weight loss, with a body weight loss of 30%. So for a person who's 120 kilograms, they would lose 18 kilograms with an endoscopic sleeve gastroplasty versus 36 kilograms with a laparoscopic sleeve gastrectomy. In the past, clinics offering the endoscopic sleeve gastroplasty have advertised it as being safer than the sleeve gastrectomy. However, this is now not true. Serious complications with the ESG can occur, like leakage, bleeding, obstruction, or dislodgement of sutures. A recent North American study, published in 2025, looked at 2,285 people who had had an endoscopic sleeve gastroplasty and 500,000 people who had a laparoscopic sleeve gastrectomy. This study showed that complications overall in both procedures were very low and that there was no difference in complications between these two procedures. So the answer is simple. The laparoscopic sleeve gastrectomy is better than the endoscopic sleeve gastroplasty, with the sleeve being just as safe and having twice the weight loss. If you want to find out more information, check out my website, drstephenkelly.com.